Hey, what's up, 185th Tribe? We're going to talk about depression and just basically 101 real quick to overcoming, really not overcoming, but understanding it is the first step to overcoming it in depression. And so I've noticed lately the ties between emotional overeating and stress eating and depression. So if you or someone you know has suddenly lost interest, is things that you normally love, or is having trouble sleeping or sleeping too much, is the possibility that depression is to play and is a culprit here. So I really want to dive into this today and establish some things that you could point out of yourself or someone you know is falling into this, especially with the times you're facing. Sometimes depression is subtle, and sometimes it can be just like in your face, right? The main thing to note is that if you're feeling hopeless, sad, and empty for more than 2 weeks, you're probably suffering from depression. Thankfully, depression is treatable, and major depression affects more than 7% of the U.S. population. That's rising. Sadly, most of the people suffering do not know they're suffering and don't seek appropriate help. This was me. I didn't know I was depressed. Like, I would never know until I started doing research, but I'm like, man, I was really depressed during that season. And so usually the reasons for not getting help involve not having the right insurance, not being able to afford care, or not accepting they have a problem because it's considered to be a made-up problem by their circle of family or friends, right? How many of us have been there? Since depression is a treatable disorder, though, this is sad. If you do seek a treatment, you're a strong person who can recover. Don't let stigma or even money stand in your way. There are often places that can help you regardless of your financial abilities. And you'll be glad you did. So the difference between depression and a low mood. Everyone experiences stressful times and low mood occasionally. Usually this is related to an event in life, such as working too long hours or a tragedy that you're coping with. But these types of low moods usually pass eventually. When a low mood does not pass, usually within 2 weeks, you can't identify why you're feeling bad, they may be suffering from depression. In addition, there are other illnesses that you can have that manifest low moods, such as a thyroid disorder, low D3 levels in blood, and an anxiety. It's imperative that you seek a professional diagnosis to be sure you really do have depression and that you treat your condition correctly. So remember that sadness, like any other feelings, is valid human emotion. Everyone feels low. Everyone who feels low is not depressed. When you're sad, it's likely that something can actually make you happy, like music or your favorite hobby. You feel better. When you're depressed, you can't even find joy in the things that used to give you joy. So depression may happen even at the happiest time of life because it has nothing to do with outward events. While it's true that sometimes depression can be triggered by normal life events or having trouble accepting and getting over them, usually happens for what seems like no reason. And it's not different from another so it's not different from getting another disease such as diabetes. It has a psychological reason for happening, even if we're not totally sure what causes it yet. But it's treatment that can help you manage or cure it or get through it during this time where you discover what the issue is. When you're depressed, you cannot just snap out of it. You can't listen to happy song, play with kids, or go for a walk, read positive things, write in a journal, and expect it to go away. So types of depression. There are many types of depression. If your symptoms have persisted for a long time, be honest with your doctor about them. Don't leave out anything. Even if you're not sure if it relates to that disorder, you want to tell the truth and be honest so you can be properly diagnosed and treated. Major depression, number one. Usually there's a combination of symptoms that have lasted 2 weeks or longer. These symptoms interfere with your ability to enjoy, may even function everyday life. Even when you love them before, you may feel empty, moody, hopeless, pessimistic, worthless, and more. You may even have thoughts of suicide or of attempted suicide. Hopefully it's not gone. Dysthymia. So in someone who has depression for more than 2 years without lifting, it's considered chronic. So chronic depression is not different from major depression, but you may have to be treated longer or if not for a lifetime. Persistent depressive disorder. Number 3, some people are depressed for a long time, over 2 years, but it comes and goes. Some days you're happy and but then the depression comes back. The difference from bipolar, in this you have manic episodes or just times of normancy. So bipolar disorder. There are many types of bipolar disorder that also involve depression. Often it's included in manic episodes where you feel on top of the world and then you plunge into the depressive end that seems to have no end. Next, seasonal affective disorder, SAD it's called. The depression that happens due to the weather, especially dreary weather that keeps you from the sun. Some people find relief using light therapy, but some don't. Psychotic depression. This is typical depression along with separation from reality. A person may suffer delusions, false beliefs that are disturbing to others and even hear voices and see things that aren't. Postpartum depression. Some women end up with this type of depression after giving birth. It's a hormonal imbalance. can happen to 15% of the women who give birth and interferes with life and the joy of being a parent. Premenstrual dysphoric disorder. So many women who have those worse premenstrual symptoms than others. Often this can be a serious depressive illness that needs treatment to help them avoid doing things they will regret. Situational depression. Most people are sad after someone they love dies, they lose a job, something else major goes wrong, but for some, they cannot shake it off and you need a little extra help. Comorbidities. Some depression is brought on by medications, drug use, or other illnesses that can change the brain and cause major depression symptoms that should be treated before getting worse. These types of depression can be diagnosed and treated by the right medical professional. So let's look at a few of the causes, signs, and symptoms of depression. The causes, signs, and symptoms of depression are, the truth is that no one is sure what causes depression. People who suffer, who seem to be happy and privileged, still suffer from depression, right, at the same rate as others. But there are some things that seem to make depression more likely in an individual. So the signs and symptoms should be around for more than 2 weeks without treatment or properly diagnosed, whether it is depression or low mood. However, if you or anyone you know is having suicide thoughts, please help immediately. So causes of depression, keep in mind that while these considered causes, not everyone has these issues, has depression. Since only about 7% of the U.S. population has depression, you can assume that more than 7% of the population has experienced one or more of these causes and yet has not developed depression. So number one, abuse. Let me tell you, I think this was caused mine. If you have a past where you experience any type of abuse, whether it's a child or adult, you may be more likely to experience a major depressive episode that requires you to seek professional treatment. Secondly, medication. There are drugs that are supposed to treat other illnesses that can bring on depression in some individuals. Some acne drugs, antiviral, will also increase your risk of developing major depression. Conflict. Someone who is susceptible to depressive episodes will develop worse symptoms when there is a lot of conflict within the family or inner circle of friends. In addition, crime victims often develop depression due to powerlessness and shame of experience. Loss. Most people experience a loss of financial or death can overcome it, but people who are predisposed to becoming depressed might find that loss triggers a severe major depression. Genetics. There is evidence that these are mental disorders that run in family. If anyone in your family suffers from depression, you are more likely to, but it's not a sure thing you will. This does not, when we look at the facts, doesn't mean that there are mechanisms behind what is triggering depression or a gene may cause it. If you have a parent sibling with depression, you may be 3 times more likely to actually develop it. Personal problems. Some people with major depression have personal problems that make them outcast to their family or their circle. This can cause someone who already has an issue to become even worse. This can sadly happen to people who have, sexual or gender identity issues, or are not accepted by loved ones for one reason or another. That's why it's important to really accept our loved ones no matter what. Serious illness, heart disease, diabetes, cancer, chronic pain, and other serious illnesses can trigger major depression. When someone is life-changing suddenly due to an illness, it can be hard to cope with and accept the new reality. Substance abuse. There's a huge link between substance abuse and untreated mental disorders. So depression could be one of those. And honestly, I think substance abuse can honestly cause depression too, right? So when it comes to substance abuse, it's not always clear what came first, the depression or the addiction. Many believe that the substance abuse often self-medicating to overcome their depression or other illnesses and then end up making the situation worse with major depressive episode. So those are some of the potential causes with depression. However, keep in mind that it's possible that these are just triggers for someone who already has the right genetic makeup to suffer from depression, since many people experience these things without suffering depressive disorders. Signs and symptoms. There are many signs and symptoms of depression to look for if you are trying to figure out what is wrong with yourself or someone close to you. But remember, only a trained professional can diagnose anyone. If you suspect that you or someone you love has a problem, please seek professional service for them. Irritable mood, number 1. If you feel irritable pretty much all the time, as well as depressed, that's a sign of potential depression, especially if this is not how you normally feel. Overwhelming sadness. If you feel like you're about to cry a lot or you're sad about everything that is happening with your circle of thoughts about sadness, sign that you may have depression. Loss of interest. This is huge. If there are things that you used to love to do and now you can't even find any joy in doing them, sign of depression. Weight changes. Often depressed individuals have changes in appetite, either eat too much or too little. Sleep disturbances. Many depressed people cannot sleep all night, or they sleep all the time, or rather sleep than do anything else. Restlessness. Some depressive people have described the feeling as if they want to do something, but they don't know what it is. They're too sluggish to do anything, and yet they have this inner restlessness feeling of things not being right. Sluggish or tired. This has been described as the feeling as if you have, just lead in your veins, no ability to wake up fully, just drag yourself around with no enthusiasm or great effort. Worthlessness. Many depressed people feel unworthy and even describe themselves as hating themselves. They cannot find reasons for why anyone else would want to be around them or why they are in this world. Guilt feelings. Often depressed people feel guilty a lot, but not about anything they can define, and then they feel guilty that they cannot do things that they want to do and feel that they should do, but they feel helpless to actually help themselves. Problems concentrating. Depression can make it hard to focus and concentrate on anything. The mind starts wandering around. Before you know it, you're confused about what you're even doing in the first place. Poor decision making. Many depressed people don't make good choices in their lives because they are trying to do anything to feel better. This may become substance abuse, going shopping, gambling, having affairs, and other things that mask depression. Thoughts of dying. Some depressed people think about dying a lot. They wish they would not wake up when they go to sleep. This breaks my heart. And this is a reason that a lot of depressed people sleep a lot. Thoughts of suicide. Not all depressed people think of suicide, but many will develop in their mind a very well laid thought out plans how they might kill themselves. They tend to run through the various scenarios, trying to pin down how they would do it. If you or anyone you know has these causes, signs, and symptoms, please seek medical professional help. You won't just snap out of it. It will just go away. Don't be ashamed, because depression is a real illness with real help for anyone who seeks it. So how men and women differ when they when it comes to depression, I think this is important. The fact that women are twice as likely as men to be diagnosed with depression, but the jury's out on whether that means they really have it more. However, women's biology is set differently than different hormonal amounts, which can explain the discrepancy. So women dwell more than men. We know that most women tend to like to talk about things, but women who is in her deep depression might have more circular thoughts and conversations with other men. Unfortunately, dwelling does not make anything better. Negative thoughts are lead to more negative emotions. Men self-medicate more than women. Men who suffer depression are more likely to use substances to overcome. Like dwelling, it just makes it worse by using the substances, more worthlessness, hopelessness, and sadness. Women tend to experience depression more by life events. So this may be because women carry most of the home and responsibility, even in today's world. So women are expected to work and be the primary caregivers at home. This overwhelms many women to the point that they struggle to process life events in a healthy manner. Depression is harder to diagnose in men because most men don't talk about their feelings and keep things close to a vest, right? It's sometimes harder to diagnose depression in men is until it's almost too late. Women experience eating disorders with depression more than men. Women often have eating disorders along with depression. Either they eat too much and gain weight, or they eat too little, or they can lose too much weight and develop anorexia or other eating disorders. That was my story. I went the way of not eating. I was battled with it for a long time in my life. And of course, I think I had a lot of depression during those times. Medications don't work the same in men and women. When it comes to providing medical treatment for depression, men and women are different in the way what works for them due to the difference in hormonal balances. Men are more likely to resort to suicide. Men commit suicide at a higher rate, partly due to the difficulty in diagnosing men. The depression might get worse when undiagnosed, causing it to become more so severe that the first time anyone realizes they're depressed is when they attempt suicide or worse, succeed. While there are differences in both diagnosis between men and women, it's imperative to get the right treatment. Most trained therapists know that there are differences and will address them. You should seek help from a therapist that makes you feel comfortable and is trained to work with your gender. The importance of seeking help, I can't stress it enough. No one thinks it's simple to get help for a problem. It's not. But when it comes to depression, the only way forward is to get help from a professional or a group of professionals that know how to diagnose the problem and monitor while you get help. The better the professional is that you choose, the more likely you are to recover from your symptoms, or at least manage them while living a satisfying, productive life. You don't have to be alone. No one needs to deal with depression on their own. In fact, nearly impossible to deal with depression on your own, especially if there is a biological component involved. People who say they've done that usually weren't really suffering from major depression, if I could put it that way. Medication isn't giving up. Some people refuse to seek help because they don't want to be medicated. I understand that. They have the idea that medication is a cop-out, sound dangerous. It's not. You should not be, there should not be a stigma surrounding medication for depression. If we'd have a stigma for diabetes and cancer medications. Dealing with friends and family, you're likely to have some friends or family think going to a psychiatrist is horrible, but others who are supportive. Surround yourself with the ones who are supportive and send educational information to those who aren't. But speak out for yourself regardless. Depression will just get worse. Without treatment, your depression will not cure itself. It may even get worse. Why suffer alone for years when you can't get help? It might take you some time to find the right person, but you would do that if you had another type of illness like cancer, right? You'd find the right person. Depression can be fatal. If not treated properly, depression can be fatal disease. It can not only lead to suicide, but can also lead to illnesses such as heart rate disease due to additional stress on your body. Seeking help for this illness is necessary, every bit as much of any other disease. If you're experiencing symptoms such as overwhelming fatigue, sadness, your work, your personal life are suffering, and you are self-medicating to cope, seek help as soon as possible. If you're suicidal, fantasizing about death, call 911. Don't stop. Treatment options for depression. There are a variety of treatment options for people who are depressed. What type of treatment you engage in depends on your desire as well as your recommendations of your doctor. Regardless of the treatment you and your doctor settle on trying, remember that this is not working. You can try something else. But most likely, just because one thing doesn't work doesn't mean that something else won't work, right? Time is really the best thing you can allow yourself because something will work eventually. Medication. There are numerous medications that can be tried for depression depending on what type of depression you have and overall health. Some medications require you that you use them longer than 30 days to ensure they work or not. Some will give you side effects that you'd rather not have, and some will not. You just need to try what your doctor wants to prescribe after doing your research to find out what will work. Talk therapy. This works best for people who have known situational that may have caused their depression, such as abuse. However, it can also work to help provide coping with the depression, right? And even coping with depression for non-situational reasons. And it can still be something that helps for anybody, really, who struggles with it. The truth is, psychotherapy can help almost anyone, even if they don't have depression, provided they are open, honest, and ready to improve. And so exercise. You probably don't feel much like exercise, but studies have shown exercise can improve mood exceptionally in depressed people. Find an exercise that does not feel like it's torture and you can actually enjoy, such as dancing, swimming, or running. Lifestyle changes. It's important you look at your life and find out what changes you can do to improve the issues you're having and the issues that are maybe contributing to your depression. Are you in a bad marriage? Do you have a job that stresses you out? Do you live a healthy life? Are you any way you can to improve your situation in your life is going to help. Sleep control. There are some studies that suggest that patients with sleep problems, the best thing to do is to improve symptoms, is to degree to sleep deprivation. Instead of sleeping 8 to 10 hours a night, work on 6 to 7. Go to bed at the same time, wake up at the same time. Usually within a few weeks, you feel differently. Hospitalization. For some who are suicidal and others destructive, the best course of action is hospitalization that will allow them to be better diagnosed while in a protected environment. There's other therapies. You probably have heard of therapies, that will actually help with extra treatment within the treatment you're getting and involve quality of life. So we can look at transmagnetic stimulation. So this non-invasive treatment uses magnetic fields to stimulate nerves to improve symptoms of depression. This is another effective treatment that is used for last resort type thing. Vagus nerve stimulation. This can be very effective treatment that uses electrical impulses to stimulate the parts of the brain that affect mood, sleep, appetite, and motivation. It's like a peacemaker, and it's inserted into the chest and attached to the vagus nerve. However, it's really on this one it is not good for some forms of illness like bipolar if one is suicidal, okay? These treatment options will give you a lot to think about when you talk to your doctor. You probably will start medication talk therapy. During talk therapy, your doctor may prescribe lifestyle changes for you to try. If that doesn't work, you may need to move on with other things on the list. So self-help strategies. Let me give you some practical things to do now. There are things that you can do on your own to help you cope with your depression. However, this doesn't work for everyone. Depression isn't typically something you can pull yourself up out of by your bootstraps, but these are things to help yourself, and these are things that I did to kind of help myself when I didn't realize it was depression. Sleep control. There's some studies that show Sleep control can improve depression, right? Specifically, sleep deprivation, which I mentioned earlier. This is not a good thing for people with bipolar, though. Okay, basically the way it works is you limit 6 to 7 hours a night of sleep. Do not allow yourself to nap, sleep in between. It's called wake therapy, and which you can read more on if you actually go and you can even Google wake therapy. Exercise. Exercise releases good endorphins. You may feel like a great while. May not feel like a great while you're doing it, but almost will, without exception, you feel better when it's over. Try to get at least 20 to 30 minutes a day, even if it's walking. Go outside. Add a benefit of vitamin D. Diet. If you're eating poorly, just improving your diet can help, but consider that the brain uses glucose to work. So if you aren't eating enough vegetables and fruit, you may not get enough glucose. Some people on low-carb diets aren't eating enough vegetables, can experience signs of depression in their diet. Vitamins. It's a good idea to ask your doctor to do a blood test for vitamin levels. Vitamins like B12, B3, and B6 can be missing from your diet. In addition, many people who suffer from depression have vitamin D deficiencies. This is huge. Journaling. Okay, journaling. If you don't journal, you need to. It's helpful to write down what you're feeling each day, but also write down your good thoughts. The brain tends to focus on anything you think about. So if you keep the positive in your life, find that gratitude by keeping a gratitude journal, you may find that you feel better. Meditate, another huge one. Join my mindfulness. Join meditation practices can always help. It's good to try to focus on nothing for a short period of time each day. Focus on your breathing, letting go of things. You learn to meditate by doing my 5-day mindfulness and meditation series, or go to 21daymind.gogen.net for my 21-day course. Light therapy. For some people who have seasonal depression, light therapy can help. The key is to do it in the morning before 10 or 11 a.m. for only about 10 to 15 minutes, and never do it at night. Some people only need to do it occasionally, but if you want to do it prior to the symptoms developing rather than they've already started. Reduce alcohol consumption. While you may love your nightly glass of wine, for some people it can cause them more depression. You may feel temporarily lighter, but when that buzz from the alcohol, right, wears off, it can cause problems the next day. Avoid self-medication. Any type of self-medication, whether illegal or illegal drugs, is a bad idea. Many drugs people can choose, such as alcohol, cannabis, and so forth. Depressants can only cause the symptoms to get worse. Do things you used to enjoy. Even though you don't feel like doing those things, the worst thing you can do is isolate yourself. You don't want to be active, right? Maybe you don't have to be as active as you were, but try to do something that you used to love, at least weekly, and, it'll make you feel like part of a process of life. Try something new. As we age, we change. Maybe you don't think things that like they used to, but you might be stuck. Why not find something new to try? You may find a whole new love for something you never considered before. Talk to people you trust. Hopefully you have some people in your life that you can trust to talk through about what you're going through. You don't have to spill all the beans all the time, but we have to have at least one person you can confide in. It can make us feel a lot better. Get into nature. The best thing anyone can do for the mood and overall is get back in nature. If you live in the city, it can be hard, but like me, I find something. I live by a place. There's often zoos, arboretums, those things. Get outside for at least 20 to 30 minutes a day. Find support. Sometimes you need support outside your family and friends. Thankfully, there are many groups on Facebook, meetups, other ways to find support groups. Try out a few new groups so you can find the right ones. I even have a support group for emotional eating, so check that out. The best ways to approach self-help is to make goals for yourself that you can accomplish within a short period of time. The more you experience success, the more you stick out the plan, the more likely you are to get there. But remember, seek professional help when you need it. Don't let it get worse, okay? So let's say that you're someone who knows someone who is depressed. How to help others who are depressed. Let's unpack this, because I think people want to be empowered. They just don't know what to do. You have friends and family who are suffering from depression. There are ways that you can help them without feeling as if you're walking on eggshells, right? Depression is a horrible illness that can be fatal if left untreated, and it can ruin relationships. Hopefully, you can understand that no one wants to be depressed, and they cannot just fix it on their own. You'll find it easier to be supportive at that point. Listen. When someone who's depressed is venting, you just listen. You don't need to give them advice to fix the problem. Let them talk. Show them that you're listening by paraphrasing back to them what they said, or by looking at them in the eyes, or kindly touching their hand or shoulder. Show you care. It's okay to show emotion when someone is being emotional about around you. Is demonstrating dangerous symptoms of depression. Sometimes you may have to show you care by calling a professional if your friend is at their end, right? That sometimes it can be the kindest thing you can do, is be willing to help them, be willing for them to hate you to get them the help they need. Don't criticize. The worst thing you can do is criticize someone who's depressed. You can bet they already have a low self-worth. This is not the time for tough love or that type of honesty. Just be there for them without judgment. Don't give ultimatums. It might be tempting, especially when it's a spouse or a child, to threaten them to give ultimatums, but doing so could make things worse. People who suffer from depression don't make good decisions, so they're not going to do so just because you gave them a push. In fact, they're likely to push you away. Understand that their pain is real. Depression sufferers are no different from anyone else suffering from a disease such as diabetes or cancer. Their pain is real. Their feelings are real. They cannot just stop this from happening to them. If they could, trust me, they would. Do not give advice. You are not an experienced therapist, so keep your advice to yourself and what to do about the depression. While some things might work well, such as exercise, eating right, and so forth, instead of giving advice, help them do that by inviting them to exercise with you. Don't say that you understand. Even if you've suffered from depression yourself, you don't know what they feel. So don't say you do. Don't turn things around about you, because they're not going to be ready to hear it until they're in therapy. Educate yourself on depression. Read books or watch documentaries about depression. Check out my depression playlist to learn all the things you can do about the danger signs, and help your family understand it, so that way you can get the most out of the information that's out there and really, really help and empower not just you, but maybe if you have family that you need to empower and surrounding people that's likely with it around that individual. Finally, if you fear for your loved one's life, ensure that you have the numbers to call at your fingertips to get that person help from a professional. So where to get help for depression? Getting help for depression can be difficult depending on where you live and what type of insurance you have, but there are usually community organizations that can help you locate providers, such as, ones if you just Google like your state or Google your country and organizations. So you may have to find an organization, like the ones outside the U.S., but you can go to link. It's and one of the links is https://www.nami.org is a great one. It'll be in the link if you're in the United States. It's a great link. Support groups. You can also look for online support groups that have sprouted up due to the, Facebook groups and other social networks, especially with COVID right now. The important thing is to remember about online groups is that they may not be led by professionals, so you should not take advice from people you meet online when it comes to anything with side effects like medication or vitamin supplements, right? There can also be offline support groups that you can find either with the help of your mental health organization or your doctor by looking at them. These are great groups and normally have a therapist leading them and cost money. But there are some free choices as well. Finally, if you or a loved one who has depression, keep the number for the National Suicide Hotline for your country nearby. The number for the USA depression hotline is 1-800-273-8255. That again, 1-800-273-8255. Find the number for other countries on the list from the International Bipolar Foundation. If you Google that, it's going to come up as well. So that's another place. Once again, the U.S. number is 1-800-273-8255. And the International Bipolar Foundation for the other ones. So if we haven't met before, my name is Jen Pike, and I simply take people from the place of stuck to authentic thriving through personal training, group fitness, life and transformational coaching, nutritional coaching, my education experience, 20 years in those fields, and I bring it into one complete program that really looks at the person holistically. And from that, that's how we obtain our weight loss goals, our goals to become the best selves in life, because we know that we are not segmented individuals, so we should not segment ourselves when we have to run from place to place. Instead, we should look at ourselves as a whole being, realize that our mind and our emotions play as much into whether or not we're fit in our body as does our working out our nutrition, right? So same thing, we need to be fit in our mind, fit in our heart, fit in our soul, spirit, as well as fit in our body. Do that 180, a totally different approach, like I had to do from when I was stuck. I had to go a totally different way, and I paid my own way and created my own method, and it's here to serve you. So in the comments, please post any questions that you have regarding a fit life, whether it be about nutrition, whether it be about depression or mental disorders, or how those tie into our emotional eating, whether it be about how to work out or about our mindset or about how to deal with emotions in general, because they're habits in life. So anything that helps you lead a fit life, live a life as a level 10, that's what I'm here for. Please comment. I'll answer your questions so I get most of my material to know what to bring to you, to really offer you that complete solution. Like, subscribe, and for this someone you know, so you can be alerted anytime I bring you relevant information for your fit life. As always, in the show notes, there's a way to get in touch with me. Don't hesitate to reach out. I am here for you. Your girl Jan, anytime. So be brave, be kind, live authentically, and always shine. And remember, tribe, you are just one habit away. Maybe the habit is getting some help for depression. And there's no shame in it at all. I get it. I understand. I would never thought like I would have been a depressed person in my life. But, you know, life circumstances and things can happen in life that really just suck us out, and we can stuff so much that happens in life that we avoid dealing with the real issue, which is, and comes out as depression. So know that there's no shame, and I'm here for you. If there's any way I can encourage you or coach you along the way, know that I've got you back. All right. Thanks for watching. Until next time, tribe.